Hello, Dr. Gray again, and I want to expand on this understanding about research and the differences between research, clinical trials, and research studies, and the different types of studies and stuff like that. What I want you to understand, or actually a statistic which is staggering, is that nearly 2 million papers, research papers, are published every year around the world. 2 million. So what does that mean? Can you read 2 million papers? You can't. It's not possible. So there are different types of studies that coalesce these researches into what we call retrospective study, where they compare a bunch of research articles that may have similar outcomes as to the efficacy of what they were trying to figure out. And we're talking right now about vitamin D and breast cancer. So I have another study that actually supports vitamin D and the impact, the positive impact it has on suppressing breast cancer, which I'll go through in a minute. But there's a few things I want you to understand about study research, clinical trials, and what have you. Clinical trials. Now, before I go into that, I've been involved in clinical trials from the drug safety aspect of it, where I worked for pharmaceutical companies while I was recovering from my stroke, and I was involved in several clinical trials, and I understand how they're done, and what situations occur while you're doing these things. So, being a drug safety individual in a clinical trial, you're sort of not favored because you're basically saying this drug caused this drug caused that. So you're sort of like the negative. So when so what happens is that it's behooves the company, the pharmaceutical company sponsoring the clinical trial, because that's who pays for it, is the pharmaceutical companies. They want good results. They don't want bad results because they've invested a lot of money and there's a lot of salaries that go into this. A lot of people are paid. So in a meeting to go over the data, there's a meeting in a clinical trial every year where you go over the data from that was gathered over that trial for that year, and I present the number of adverse events or bad side effects that have occurred over that year in the certain trials. And I'm just one individual. So there's one safety person with a medical doctor attached to them, and that's all they have. So the analysis part, the analysts who analyze the data, okay, they're like 10 to 12 people analyzing the data, and there's just one safety person. That's just a little tidbit of information, something I personally experienced, to make you realize just how things are done. So before I go into this research paper in terms of vitamin D, you understand now there are 2 million papers published every year, which is a lot to read. There are 8 types of papers, and clinical trials being one of them. In clinical trials are in phase. You've heard, this vaccine is in phase 1, clinical trials, phase 2, whatever. I'm going to explain what the phases are. The FDA requires 3 phases of clinical trials before they even think about the drug, whether it's approved or not. Phase 1 clinical trials is a very small trial, not many individuals, and it's usually healthy individuals, and they're determining whether the drug is safe to take. That's where drug safety is very important. That if the drug is unsafe at that point, it doesn't go to the next phase. Phase 2 is to determine what dosage the drug has the best effect. And that's usually semi-healthy people with the issue that the drug wants to address. Phase 3 are large studies. So the first two, phase 1 and 2, are really small. Phase 3 is a large study, which is also looking at sort of refining the dosage, refining the side effects, because they have to address the side effects with the FDA. They have to put that in. This drug will do this, and that. However, they say, but the benefit of the drug outweighs the bad effects of the drug. They have another phase called phase 4, which is after market or after approval, and off-label use. So in other words, they'll say, so X drug, we want to use it for X disease. It wasn't originally approved for that disease, but we're going to see how it turns out to affect that. Or we want to change the dosage, or we want to see how it affects other aspects of the body. That's a phase 4 clinical trial. And then there's something called pharmacovigilance, which is I was heavily involved in, and that's where people with the drug has already been approved and it's being used will call in and say, hey, I had this rash or I had this problem. It's just all these reports have to be added up and they sent to the FDA, and the FDA determines if the drug is still safe or not, or whether the drug needs what's called a black box. In other words, a warning that people with this condition should not take this drug. So that's basically it. 4 phases and then pharmacovigilance. The first one is just for safety. The second one is determine dosage and are usually salt. The third one is large and is checking both dosage and safety. The fourth one is after the drug has been approved for, let's say, congestive heart failure, they want to see if it'll work on psoriasis. And that's a different study altogether. And then there's pharmacovigilance, which is after the drug has been approved, anyone that has an adverse reaction needs to be reported that that drug caused an adverse reaction, and that gets reported to the FDA. So it behooves the medical doctor that prescribed the drug, and if the individual had a bad reaction to that drug, that needs to be reported to the FDA, regardless of the dosage or whatever. It doesn't really matter. It has to be reported so that the FDA can make a determination. We've seen this about 15 times out of 20. Could be a potential problem with this drug. Many drugs were taken off the market because of that, and a drug that was for congestive heart failure, I think, was taken off the market some 20 years ago when I was working. I was at a seminar, and the 2 people that were drug safety for that drug, pharmacovigilance for that drug, had to leave the seminar because they had to find a way to take it off the market. Otherwise, the company would have lost a lot more money. So that's just the overview of clinical trials and my experience with clinical trials. So what I want to do now is just read this research paper on vitamin D and breast cancer, and it does support vitamin D. It supports the premise, like the other article did, that it reduces the risk of breast cancer, induces the cancer itself, and it's by way of vitamin D receptors. Remember I mentioned in the last video the vitamin D receptors. So let's go ahead and read. I'm going to read the abstract first, or the background. So it says here under the abstract, vitamin D has been suggested to prevent and improve the prognosis of cervical cancer, or several cancers, including breast cancer. Now, we have previously shown a U-shaped association between pre-diagnostic serum levels of vitamin D and risk of breast cancer-related death, with poor survival in patients with the lowest and the highest levels respectively, as compared to the intermediate group. Vitamin D exerts its function through the vitamin D receptor, and the aim of the current study was to investigate if the expression of the vitamin D receptor in invasive breast cancer tumors is associated with breast cancer prognosis. Prognosis meaning chances of recovery. Is it a good prognosis? Is it a bad prognosis? Prognosis means, are you going to survive or not survive? So their methods, they write about their methods. They say VDR expression, or the vitamin D receptor expression, was evaluated in a tissue microarray of 712 invasive breast tumors. So they actually got breast tumors and they looked at the tissue after they were biopsied. And what they discovered, let's see, how am I going to put it? So the correlation between VDR expression and the established prognostic factors for breast cancer was analyzed, as well as the association between VDR expression and breast cancer mortality. In other words, they looked at this breast cancer tissue and they said, how how active or whatever is the VDR in this tissue? Is the VDR, the vitamin D receptors, strong in these tissues, or are they weak in these tissues? That's all they're trying to do. And they came up with results. And they said, we found that positive VDR expression in the nuclei and cytoplasm of breast cancer cells was associated with favorable tumor characteristics such as smaller size, lower grade estrogen receptor positivity and progesterone receptor positivity, and lower expression of Ki-67. Ki-67, the higher that is, that's just a number, that means the more aggressive the cancer is. In addition, both intranuclear and cytoplasmic VDR expression were associated with a low risk of breast cancer mortality. So in other words, just saying that in the cell itself and in the higher the level of vitamin D receptor activity, the better chance of breast cancer survival. Now, so the conclusion here is that this study found that high expression of VDR in invasive breast tumors associated with favorable prognostic factors and a low risk of breast cancer death. Hence, a high VDR expression is a positive prognostic factor. In other words, the higher your VDR expression, the higher the receptors are being activated, because the higher levels of vitamin D in the system, the better chance of you surviving breast cancer. That's all it's saying. That's comparing one factor with another. It's a comparison factor. So they're saying that vitamin D levels that are really high or really low are not necessarily good, but levels that are in the intermediate range are okay. And that actually makes breast cancer less virulent and you have a less mortality rate with individuals that have a better vitamin D environment in their body. That's all it's saying. So that's 2 research papers that actually say vitamin D is helpful. There are many more, and I might talk about a couple more, and then we'll move on to other interesting research in regards to problems that humanity is suffering from. So this is Dr. Greg, changing the way we look at health.